to standards of care that have been developed through professional nursing judgment in every hospital, on every shift, in every unit across the entire state. It's an honor to have the Standards of Care Act introduced today by two dynamic elected officials, Senator Jeff Hayden and Representatives Joe Adkins. They share our concern that patients are needlessly at risk in our hospitals, not because there are not enough nurses, but because there are not enough nurses working on duty at the time patients need us. These politicians share our certainty that a solution lies in evidence-based, nationally accepted professional standards regarding patient assignments. It is my pleasure to introduce the authors of the Standards of Care Act and invite them to share their own perspectives regarding the bill. First is Senator Jeff Hayden, representing Senate District 62. He has served in the legislature as a legislator since 2008, first in the House and then elected to the Senate in a special election in 2011. Senator Hayden has been a strong advocate for healthy communities, both in the legislative work and as managers of the Hearth Connection, an organization that provides affordable housing advocacy. As Deputy Majority Leader and member of the Healthcare and Human Services Policy and Oversight Committee, Senator Hayden is well-versed in the foundations of our healthcare. Please help me welcome Senator Hayden. Thank you, Senator.
Well, I love the clapping there. I didn't usually get those on press conferences. Well, welcome you guys. We are here finally to work on this bill, the Standards of Care Act. I know it has been widely anticipated around the Capitol, and we're happy today with my colleague, the Commerce Chair, Joe Atkins, to bring this bill and have a really, really good conversation. You know, legislation puts the decision at the bedside, not at the Capitol. Study after study shows proper staffing lowers health care costs. Other states that have implemented and or studied staffing standards reports the probability of death drops by double digits. Nurses working at the bedside tell me that they're at risk, and I believe them, and that's part of the story. You know, one of the things that we really want to do here is we don't want to demonize or vilify our hospitals, but what we really want to do is to have a conversation at the Capitol that really talks about these issues. And I think today, often kind of people kind of get entrenched in their positions, and we're hoping that the legislature and the conversation that we're going to have over the coming weeks really kind of teases out these issues. The legislation is meant to monitor, enforce, and offer incentives to meet the minimum standards. The legislation means nurses will be able to affect staffing decisions, while for years they haven't been able to have, I think, as much of a voice as they wanted to have in this particular issue. I know that this is contentious. We're going to have a very open process. I think that those that not only represent the hospitals, we've already had a lot of conversations over in the course of this session already about this issue. I know that there are a lot of concerns about those that might be affected, including those that support nurses, and then most certainly the nurses themselves in terms of the work that they do to affect patient care. My involvement in this is really to make sure we have great patient care, that we work as hard as we can to make sure those at the bedside are being protected and are able to do patient care, and at the same time making sure that hospitals are able to continue to function and be able to go about their business and helping people get well. We think that this is really important, and I'm really hoping that we have a really great dialogue and hopefully get this bill implemented in some form or fashion so that we can continue to move forward with our health care reform, which we think is really important. So thank you, guys.
Thank you, Senator. Representative Joe Atkins of Inver Grove Heights brings great energy to anything he does. He has represented the people of District 52B since 2002 with great dedication and skill. A lawyer by trade, He began his political career at age 21, elected as the youngest school board member in the nation at that time. Representative Atkins has boldly chosen to champion the key issues facing Minnesotans today, authoring this important Standards of Care Act, as well as legislation regarding Minnesota's health insurance exchange legislation. Please help me welcome Senator Joe Atkins.
Thank you.
Thank you.
After that introduction, I feel like I should get an award or something. Well, thank you very much for coming. I think Senator Hayden gave a nice overview of what we're hoping to accomplish. For decades, we have debated pupil-teacher ratios in schools because education is so important. And yet we haven't had a conversation, a good conversation about patient and nurse staffing ratios in our hospitals when life and death is at issue. As the study after study will show, or has shown, this actually leads to a decrease in healthcare costs. And in states that have instituted this change, we've actually seen double-digit decreases in the probability of death. This is an important bill. It's an important conversation to have. I look forward to working with the hospitals. In fact, we did a very unusual thing for the Capitol Press Corps that's here today. Normally, the folks that are on the other side that are being impacted by legislation are not included in the conversation until the bill is already introduced. And I actually reached out with Senator Hayden's blessing as well to the hospitals ahead of time. They've actually seen this legislation beforehand. Rather than wait until it's formally introduced tomorrow or when they hear about it in the media. That is not the kind of conversation we want to have. We have professionals on both sides of the table. We've got folks that really care about their patients on both sides of this issue, and we look forward to having that dialogue and coming up with a good solution, not just for nurses and not just for hospitals, but for the patients that they serve. Thank you very much for coming this morning, and thank you.
Thank you. Thank you, representatives. Finally, to give us more insight from a daily perspective of why the Standards of Care Act is so essential to the safety of patients are two colleagues of mine. In the nursing profession, Susan Kreitz and Sandy Anderson have a combined professional career as registered nurses of over 60 years. They advocate for patients every day in the cardiac care and medical surgical units at Fairview Lakes Hospital in Wyoming. They also dedicate time to advancing the profession by serving on M&A's Commission on Nursing Practice. Today, they bring their advocacy to the Capitol to help patients throughout the state. I would like you to welcome Susan Kreitz and Sandy Anderson.
Thank you, Senator Hayden and Representative Atkins, for taking the lead on a simple measure that will positively impact so many lives and reduce health care costs. I am Sandy Anderson, and I am proud to be a registered nurse. Patients are suffering, and families are grieving, and they are being exposed to too much risk in acute care hospitals today. It is all so unnecessary. Too often, I and my colleagues are faced with the circumstances of ignoring someone in order to take care for someone else. That someone is perhaps a grandparent in a confused state who tries to get out of bed and falls. Now she has a broken hip or has struck her head. She is suffering, and we may lose her. Someone else may be a dying carpenter whose family can't get to his side in time, and even I can't be there to hold his hand. Another someone is a child being discharged whose parents may not fully understand the instructions I have to rush through. Beyond the closed doors, behind the curtains, below the shining brass awards for safety, nurses witness too much suffering and too many errors. We catch way too many near misses because we are stretched dangerously thin. We need a standard of care that makes it incumbent upon hospitals to ensure enough nurses are on duty according to patient care standards, needs per unit and per shift. The bill further states that in developing patient assignments, hospitals will abide by nationally accepted, evidence-based standards established by professional specialty nursing organizations. In addition, assignment limits would be adjustable for patient acuity and nursing intensity. The measure would also enforce consequences for facilities to fail to meet these standards. It is simple, it is comprehensive, it will reduce grief, suffering, and cost. Every patient deserves a standard of care.
I'm Susan Kreitz, and I too am proud to be a registered nurse. Last week I read the annual Adverse Health Event Report issued by the Minnesota Department of Health. I was disappointed to learn that after 9 years, hospitals are still reporting 314 adverse events that could have been prevented. 103 of those events resulted in a serious injury or in death. 5 years ago, there were 312, just 2 fewer than of the adverse events that have happened this year. That's not a record of achievement by any standard. Beyond the sobering revelations of this report, nurses at the bedside are deeply concerned that other troubling instances are not reported. We catch our breath every time that we have a near miss, or we give a late medication, or a discharge that we have to hurry up and do, and we can't really give the proper instruction for a mom with a child they're taking home. We provide a safety net through our continual monitoring, but we see the foundation of that is net eroding more and more each day. Our frustration mounts when we warn our managers that in our professional judgment, our patients are at risk as a result of not enough time to provide adequate care for the amount of patients at the level of acuity that we are assigned to. Sadly, our notice is sometimes met with no response at all, or more often, a hollow, make do with what you have. The members of the Minnesota Nurses Association have worked hard in our contracts to protect us when we speak up, but reducing patient risk requires consistent standard of care in every facility, every day, every shift, everywhere across Minnesota. From Ely to Worthington, from Marshall to the Twin Cities, every hospital needs to be held accountable for providing an environment that allows nurses proper time to assess and assure the safety of those we take care of. We need a law for this upcoming session, and however many more sessions we need, Minnesota Nurses Association will lobby for lives depend on it. We will expose the crises occurring in the acute care settings all across the state. We will not stop until every facility, every shift, every patient in Minnesota is safe with the care they need when they need it, because lives depend on that.
We know there's research out there. Our organizations such as the operating room nurses or the neonatal nurses, they've researched. They know how much time it takes to care for children, for adults that need care. Let's use that research. Let's work together. Let's have a law that can mandate that care, because we need to have professional nurses doing a professional job every shift. And now I'd like to ask Carol Diemert to the podium. Oh, you're already here. Carol is M&A staff, who is our nurse practice specialist. She will take your questions.
So what does this look like? I mean, does each hospital have to have, say, 30 nurses per shift in an emergency room? How do you see this shaping out?
It would be by different types of department and different types of unit, because it's clear from the research that patients in critical care or in the advanced stages of labor or post-anesthesia, operating room, those require a lot more of not only skill of the nurse, but also time of the nurse. So it really depends upon the area, and that's why we're promoting and recommending the professional nursing standards, because they're by different types of units.
Is it your expectation mean, you know this literature well. Are there standards out there, or do you expect this committee will do the bulk of the work?
There are standards out there for the specialties that I just mentioned. The research is less predictive on some of the medical surgical because the array of patients is much broader. You know, you can really categorize nurses who are in, you know, critical care because there's a certain level of care that's needed. But medical surgical units, which are the general units, are much broader. And, you know, the Institute of Medicine report recently, when it's a whole report on keeping patients safe, have recommended for med-surg and 4 patients to 1 nurse. But we are really understanding that ratios is not the whole story. We want to get to the point where the number of the amount of time that nurses spend with the patient and the type of care that they need is really the standard. And that's why we're, you know, recommending using the patient standards.
Just a quick follow-up on that. To the extent this committee does the work, they're appointed by, it says the commissioner. Which commissioner?
Commissioner of Health.
Of Health. And, I mean, you all know that, I mean, you mentioned this is not a face-off. It's a face-off every time we write about it because there are nurses who are in unions who cite some studies. There are nurses in management who cite other studies. So how do you, I mean, so it's up to the Commissioner of Health, I guess, to figure out which nurses get to sit?
Well, that's why I think in the composition of that committee, it's a broad array of representatives. And, you know, we understand that it's controversial. That's why we want to have the conversation, because nurses are feeling pressured about patient safety. They have a legal and ethical obligation under the Nurse Practice Act, under the Code of Ethics, to promote patient safety, and they're advocates. So they're put in difficult positions. So we want to have a conversation about this.
Are these conversations not happening now in hospitals, or is it too scattered across the board? What's the problem that you need a law to
The problem really is that professional judgment of nurses is not always does not always take the place of what management decisions are. So often the nurses are not replaced on shifts of open positions, or they don't have enough because of the type of unit there is. So, you know, we can't agree more that this should be decided by the nurse at the bedside. That is our total mantra about this. But often that is not happening. And Linda probably has some. I mean, there's other people that have specifics around that, but that has been all too often. We have been trying to encourage nurses to not accept assignments that are unsafe because it puts the patient in jeopardy. So, you know, we just want to have conversations to see both sides of this issue, because we also know that cost is an issue. I mean, we can't ignore that.
Will this result in the hiring of more nurses, and if so, do you have an estimate of how many?
I don't have an estimate on how many. I think it may or it may not. I think the issue has been on the places that studies have done that have studied this is that actually it may result in more nurses, but the cost has gone down because you're preventing issues. You probably know that there's a 30-day readmission rate, that if that is preventable, hospitals are not being reimbursed for it. And our point of view is that this could definitely be reduced if we had more nurses. So there's a cost benefit to hiring more nurses.
Does this put the hospitals in the position of having to lay off some of the licensed medical nurses or other staff, nursing assistants, in order to accommodate the staffing levels, the patient staffing levels that this would bring about?
Actually, that did not happen in California. There's a recent study that shows that it did not decrease the skill mix of other personnel.
You know what the skill mix is right now?
I don't know offhand.
Is California
It
the only other
varies.
state right now with a law like this on the books?
Well, it's the only state with ratios. There are other states that have some similar kinds of patient safety standards in law.
What are those states? Do you know what the states are?
Do you know, Carrie, what the states? I think Illinois, Washington, Illinois. I think there's 9 states that have that. Florida. I think there are 9 states that have in law some type of patient safety standards.
And if you were to cite, I mean, I think one of you mentioned the annual adverse health events.
Mm-hmm.
Is that the best statement of what you all see as the problem in Minnesota, or are there other? I mean, what would you point to kind of show evidence that Minnesota needs to do this?
Well, it's one of the measures. There are, in the last decade, over 60 studies that show the correlation between increased registered nurses and patient outcomes. And I think that's why we want to have a conversation and get more data. There isn't good data, state-specific at this point. So, we are wanting to do that. But I can tell you there are over 60 studies that have shown the correlation in the last decade.
Representative Atkins, you mentioned that you talked to the hospitals about this before bringing this forth. Can you give us some sense of what the feedback was?
Well, I told them I had to leave, so I was literally coming over here to see you folks. I got, as I was walking out of the room, though, a couple of, I would say, very hearty thank yous, because this is kind of an unusual approach to share it with folks on the other side, or potentially on the other side. I would hope by the time we get done with this, we're all on the same side, rather than, as we've had described, the face-off that's occurred in past years. It's noteworthy, by the way, and some have followed this for a long time, but there's a distinct difference between this version of the bill and what's been put out in previous years, and that is that rather than having hard and fast figures of X number per patient, the difference here is that we're looking at nationally accepted evidence-based standards that are brought, that have some thought behind them, and that makes sense depending on the situation that the nurse is faced with and the hospital is faced with.
But by March of next year, you would expect to have kind of a point-by-point, hospital-by-hospital roster? I mean, it looks like in here that these committees have to report back for the various hospitals by March of 2014, should this become law. Is that how this thing would roll out?
That's what we're aiming for in the legislation. We're also looking for input, though, from anybody that cares if they've got different ideas.
Each hospital would have a staffing plan in print somewhere that either a nurse,
Yes.
patient, whoever would look at to say, are they staffing adequate?
Right. And that's a good point, because we didn't really talk about the guts of the bill in particular. There's also reporting requirements, there's posting requirements. My dad passed away in September, and we had spent months in hospitals prior to that. It was this just purely anecdotal, but as a purchaser or consumer of healthcare services, felt a little bit like we didn't really know what we were getting ourselves into. You didn't know what the ratios were. Anecdotally, there were situations where nurses were saying, it's just a really bad time right now. We don't have, and the folks here on the front lines can talk to that better than I can, certainly, but that's the sort of conversation we hope to have and figure out if there's a way to improve the system that Minnesota delivers. And at least for my sake, folks, I got to run. These folks, I think they're here to answer questions until like 4 or 4:30, but then they've got to be out. But we appreciate your attendance this morning. Have a good day.
Thank you. Thank you, and I thank you all for coming. We're welcome to ask questions if you care to afterward, and I do sincerely hope that the message that we're giving is this is about patients. We take care of human beings that are precious. And it might be babies in my case. They may be the elderly and dying in somebody else's case. Either way, there's somebody's son, daughter, mother, child. They need our care. And I want to be there for that care. It's not about nursing jobs. This is about care. And as nurses, that care that we need to give you as a patient is invaluable. Thank you.
Sure. Let me just make sure. So yours, Susan.
I'm Susan. Which hospital are you at? Fairview
adverse event reports.
Yes, yes.
So you're Sandra, and where are you from?
Also Fairview Lake. Yes, yes.
I was going to say, I only remembered hearing one hospital name. And
That,
That's it.
what sort of nurse?
I work on the med surg.